Let's spill the tea on HRT. See what I did there? I'm going to discuss what dose of estrogen is appropriate and why doing routine estrogen hormone blood tests are not recommended by the British Menopause Society. Firstly, happy Menopause Awareness Month, and the theme this year is hormone replacement therapy. So let's look at the data and get right into it. I'm an NHS GP and I do women's health and menopause care. One of the most important questions that I get asked is, why would I take hormone replacement therapy? What are the indications for it? For the purpose of this video, I'm going to talk about systemic HRT. There is a difference between localized, so that acts on a specific area of the body, such as vaginal estrogen only works in and around the vulva and the vaginal tissue, and then systemic HRT, which is absorbed into the bloodstream and acts on the entire body. Now, systemic HRT comes as a spray, which you use on your arm. It can come as patches, tablets, gels, and also oral capsules as well, such as progesterone, as shown in this picture. You can also have the Mirena coil, which can be used as part of your progesterone component of your HRT. Now, if you have a womb, you'll need progesterone. Progesterone provides endometrial protection whilst using systemic estrogen, such as a spray, gel, or patches, especially if there are patches that do not have a progesterone component part of it. So if you have a womb, you'll need estrogen and progesterone. For those that do not have a womb because they've had surgery to have their womb removed, they will just need estrogen alone. And again, that can come as spray, patches, or gels, or tablets which just have estrogen in them. The indication of going on systemic hormone replacement therapy, HRT, is because the NICE guidelines state that that is the first line treatment for the management of menopausal symptoms and certain conditions. It's not antidepressants. You do not use antidepressants as first line treatment for menopausal symptoms. So the menopausal symptoms that we're talking about are hot flushes, night sweats, low mood, brain fog, genitourinary syndrome, the menopause. Conditions such as primary ovarian insufficiency also would need HRT as first-line treatment, and surgical menopause, whereby the ovaries have been removed, and also for the prevention of osteoporosis, bone loss, and reducing the risk of fractures. Those are the indications of why HRT should be used. The million-dollar question. Now, do all women need systemic HRT? Well, the simple answer is no, but let me explain that in a bit more detail. So imagine we use the red light system for all the menopausal symptoms that you are experiencing. I would also be investigating you for other medical conditions because, as you can see, a lot of the symptoms can overlap with other diagnoses. But if we're confident that the symptoms are menopausal and you know your body the best, we are then going to look at how we can manage your symptoms in the best way possible. Now, take a look at these menopausal symptoms. You are more than welcome to pause the video if you need to at this point. And if you've been tracking your symptoms, and actually for some women that I see in my practice, they say, do you know what, I feel okay. So they are hitting green for a lot of the symptoms, and they're managing that through diet, through exercise, through looking at their nutrition, through doing mindfulness, wellness, so taking a whole holistic view of managing their symptoms. But then I can get some patients who feel really exhausted by their symptoms. They are ticking a lot of these and it's impacting their life. They might say, look, I'm amber or I'm yellow and I'm feeling like I might need some help. And that's when they might want to think about hormone replacement therapy. And finally, some of my patients are just feeling absolutely debilitated by their symptoms. And sometimes you could go between all three, from green, amber to red, before you feel that actually you might need to have some support. And whether that's holistically you're doing everything right and you might need to think about hormone replacement therapy then. This is why keeping a track of your symptoms is so important. Now, as women, we know ourselves so well, and you don't have to wait until you're in the red zone to ask for help or hormone replacement therapy. The underlying theme is that holistic management, work-life balance, looking at exercise, strengthening, looking at mineral amount that you're having with your nutrition, wellness, mindfulness, all of those things combined are just as crucial as taking hormone replacement therapy for managing your symptoms. When it comes to systemic HRT, one of the areas that we do need more data and research on is, does HRT reduce the risk of dementia? Does it reduce the risk of autoimmune conditions? And does it help with musculoskeletal syndrome or the menopause? Now, we just don't have enough meta-analysis, Cochrane research-based data to back up those claims, but it looks good, and it could be that in the future that things will change. Alongside giving systemic estrogen, we also have to think about how to protect the lining of the womb. That can be done as a Mirena coil or as utrogestan capsules, as you can see up in that corner over there. So let me just get a bit closer. So those are the utrogestan capsules that we would want to give you. We might also think about giving you estrogen and progesterone combined in a patch as well, and there are certain brands that do that. You do not need to stay on the same dose of estrogen and progesterone throughout the journey that you're on whilst taking hormone replacement therapy. So although we start low, we have to gradually increase, making sure that we are dealing with these symptoms. It's always management of your symptoms. And so the dose adjustment is done via your symptoms. So keeping a track of your symptoms, again, is so important once you're on hormone replacement therapy. Once we start systemic hormone replacement therapy, it can take 6 weeks to 12 weeks to sometimes even notice the full effect of it, because the dose has to gradually build up. And if you've never had periods or your periods have settled down, you can notice that you're getting vaginal bleeding again. Now, it's really important that if you're getting unscheduled vaginal bleeding or bleeding that's really heavy, that you consistently let your doctor know or your menopause specialist know, because then they can adjust the doses and give you the right progesterone component to thin down the lining and provide you that endometrial protection that you need. Bleeding on starting hormone replacement therapy is normal, and also bleeding on HRT every single time we do a dose adjustment of estrogen is also normal. So it's always judging by the parameters of what is not normal for you and then tailor making it and tweaking that HRT for you. Again, this is a valid and very good question. Why don't we just do estrogen hormone blood levels? Well, the simple answer is that it's not recommended by British Menopause Society. Let me break that down for you. The data shows that doing estrogen blood levels can be unreliable. Many factors affect the accuracy of the blood test. So lab variations, we don't actually have the actual clinical numbers, skin cell packing, and also the application site. All of these HRTs have different places where you would need to put them on, and they have different absorptions. Number two, the response to HRT should always be based on symptoms, not blood tests, because blood tests vary. HRT specialists usually check how patients are responding to the treatment by monitoring their symptoms before doing blood tests. And number three, routine testing is expensive for both patients and the NHS, especially with the factors before that I've explained. However, blood tests can be helpful in some cases. The times when it might be useful to do estrogen hormone blood tests are when symptoms are not well controlled and the patient is on a good dose of hormone replacement therapy. So a blood test for estradiol or estrogen hormone blood test might be useful to check if the patient is absorbing estrogen effectively. Also, another indication might be if they don't respond to the symptoms at all or respond to the adequate dose of HRT. Therefore, it could also be an indicator, because it can help you if there are other issues that could be at play, not just the menopause being the cause of the symptoms that the patient is going through. Now, higher doses of estrogen can sometimes be needed. The dose adjustments of the estrogen that you're taking, whether that's estrogel, Sandrina, Lenzetto, a patch, or any other sort of oral estrogen tablet, it would be based on the fact that we would follow your symptom response, making sure all the time we're ruling out other diagnoses of what your symptoms could be contributed to. And again, based on the level of estrogen that you're on, whether that's ultra low, standard, moderate, or high levels of estrogen, we would need to give you the appropriate amount of progesterone cover, whether that's either as micronized progesterone, as a oral tablet, norethistron, or whether you're having the coil. So this is here is the coil, whether you're having that for up to 5 years as the progesterone component of your HRT. And of course, high doses of estrogen can sometimes be needed in some women. For example, primary ovarian insufficiency patients. This is the Daisy Network website. It's really great and gives great advice in regards to management. And they actually say that in contrast to women who have menopause through the average age, women with primary ovarian insufficiency typically need higher estrogen doses, and that could be variable to achieve physiological levels. And therefore, sometimes it's worth doing levels, but again, it's an individual basis, an individual treatment plan for each woman. Navigating our lives as we get older is really difficult, especially when we're pulled in different directions, and typically we are becoming more a sandwich generation. We always need to make sure that we're getting the right amount of estrogen and the progesterone cover in making sure that we get the endometrial protection that we need when we're taking HRT. But as we get older, the risk of breast cancer increases, the risk of cardiovascular problems increase as well. The risk of type 2 diabetes, weight gain naturally happens. Our mood can become worse as well. Our bones become more frail as we get older. And also the risk of endometrial cancer or endometrial hyperplasia naturally increases. Menopause is a tricky time to navigate at the best of times. I say that as an NHS doctor who looks after lots of patients and also someone who's heading towards perimenopause myself. Like everything in medicine, your lifestyle underpins how we are managing you, what your life choices are that are going to impact on your health. Getting movement into your day, resistance exercise, weightlifting, looking at your nutrition. It might be that you have to overhaul your diet, stopping smoking, reducing alcohol intake, taking vitamin D, maybe taking iron supplements if you have heavy periods, somebody like myself. Could be that you want to take other supplements alongside that. Looking at your work-life balance, looking at mindfulness. Look, there is no individual journey that is the same when it comes to the menopause. The bottom line is we are all still fighting for more research into the appropriate doses of HRT, the safety of HRT, and the choices for those who can't or don't want to have HRT. We are still stuck there. So rather than getting our pitchforks out and arguing with each other about what's right, what's wrong, and who's doing it the best way possible, because I tell you, there is no best way possible. The NHS isn't getting it right all the time, and I know that as an NHS clinician, but we get so much stuff right in the NHS. There's 51% of my population at my surgery are women, and they are going to need care. Why are we? So in some cases, I've even had patients tell me that they were encouraged to go privately to get their menopause sorted. That is not the system that we need as women. So let's work collaboratively with each other. Let's look at how we can manage women within the NHS properly. And that comes from systems and higher up. Let's get the data and the research that we need. Because Lord knows, and I can tell you, I'm exhausted. We don't need to be fighting each other. We need to be working collaboratively. And I don't care who takes credit for doing any of that work, as long as we are just getting to the end point. So for World Menopause Day, it's all about hormone replacement therapy. And if we can do one thing is please, for those that are listening and watching this video, let's drive better research. Let's not start picking each other and who's doing right and wrong. Let's actually make sure that the next generation can be proud of the fact that we made menopause matter. Thank you. I hope that's been helpful. Sorry for the rant.